If you're having nonspecific low back pain and you're a woman, hear me out. Your low back pain could be caused by a mechanical dysfunction in your back. Things such as a facet entrapment, you could have an SI joint dysfunction, yes, you could have a disc herniation. But more often than not, you really do have some weak abdominals, weak glutes, weak pelvic floor, because your body has gone through a trauma. And with that trauma comes stretched out muscle. Unless you specifically work with somebody to help you rehab those muscles back, they don't always just come back. It's a lie that we were taught that you could just spontaneously heal on your own, but women, no. So I'm a physical therapist and I treat women. And the things that I do on my evaluation is I look at you specifically for these things. I check the mobility of your hip and check your range of motion. I check the muscle length of your hip flexors and kind of see where you're tight. I check the strength of your abs, hips, pelvic floor, everything. So if you want to do your own investigative work, check the range of motion. What feels limited? See what's weak, what's painful. So for instance, if you have a hip issue and your hip is stiff, I would suggest trying a hip mobility routine. If your abdominals are weak, I would suggest we start strengthening your abs, but actually I would start with the diaphragmatic breathing and working on your exhale. Your pelvic floor, I would love you to do 10 times 5 seconds. Heck, if you could even do yoga 3 times a week and do some sun salutations and really focus on stacking your ribs over your pelvis, I would be totally pumped. Oh, also, please try to walk 10,000 steps. And maybe we could do lifting 3 times a week. Please get your water in and hit the plus sign for more.